The following is a presentation of 5 things every parent should know about teen substance abuse. For more information, please visit our website at www.5thingsonline.com. Five things every parent should know about teen substance abuse. Part 3 in a 5-part series. Number 3. Denial is part of the problem. It's no big newsflash that denial is a huge problem when it comes to implementing any kind of effective prevention and intervention efforts with regards to teen substance abuse. However, my reason for including this as one of the 5 things is to, in effect, pull the curtain back on this culprit and remove its power. We can deal with denial. One of parents' biggest fears at the prospect of confronting a substance abuse problem with their teen is dealing with resistance. They believe that nothing can be done as long as he doesn't want help. Well, this is wrong. By identifying denial as simply an inherent part of the problem, we take this into account and move forward accordingly. With substance abuse, we see 3 aspects of denial, each with a respective cause and manifestation. The first is shame. Substance abuse is generally considered as wrong, and someone being questioned about this will typically be defensive. The manifestation of this is to minimize, or literally deny certain facts. This results in the cliché responses such as, "I only had a couple," "I've only done it a couple of times," or "I wasn't on anything, it was a reaction to my asthma medicine." Ask anyone to describe how much he or she engages in behavior that's considered a vice, and they'll probably minimize, even if they think they're telling the truth. I know that if I were asked to report how often I eat ice cream, my answer probably wouldn't match the recorded results if they had a secret video camera in my kitchen. When I get done taking an adolescent's chemical use history, I always say, "Now, you know I'm going to automatically add 20% to what you just told me because of the minimization factor," and they never object or disagree. Rather, they just nod and grin sheepishly. The second is resistance. Intervening on a substance abuse problem means that something enjoyable is being taken away. It's only natural to be resistant. In this case, resistance is actually the manifestation. The cause would be the feelings of fear, anger, or sadness at the loss of their chemical use. In Part 4, we'll learn that this is actually way more than just enjoyable, and extreme resistance is understandable. Again, this doesn't mean that there's nothing that can be done because the client doesn't want to cooperate. It simply means we deal with him or her accordingly. The third aspect of denial is ignorance. Addiction is grossly misunderstood by the majority of the general population. This manifests in poor follow-through with professional recommendations, as the client thinks he or she knows more about the problem than the professional. The problem of denial extends to those responsible for the client and the community in general. Lack of community awareness about the nature of addiction and how it's treated adds to the shame and stigma often associated with addressing a drug abuse problem, which in turn leads to the failure of utilizing available services and getting adolescents the help they need. Okay, enough about the problem. Let's get into the solution. As I said, we're going to have denial, so we make plans to deal with it. It's really quite simple, at least on paper. The most effective solution to denial is obviously education. This can and should begin at the time of assessment. My experience has been that by simply taking the time to teach parents and kids the basics about what it means to have a problem goes a long way in removing resistance and helping clients become willing to follow through with recommendations. Along the same lines, helping a client understand that addiction is an illness, not a badness, see Part 4, and there is no shame in having a drug problem is another example of how educating the client helps to remove resistance. Denial comes in many forms, most often manifested in some of the typical things heard in an assessment, both from the teen and the parents. "I can quit whenever I want to. I've done it before." "Weed's not that bad for you." "We're thinking about military school." We feel as depression is the underlying issue, and that's what needs to be addressed. We hear this all the time, and the trained substance abuse professional knows how each one of these statements represents lack of awareness about the issue. However, this is where we have to be patient and use our skills to effectively provide the education needed to address the denial. The other aspect of resistance has to do with not wanting to give up what they enjoy, and adolescents can dig their heels in pretty deep. However, for the most part, this simply has to do with defense mechanisms, and with a little psychological elbow grease, defense mechanisms can be removed. Most often, the degree of resistance is directly related to the amount of wiggle room they believe they have with regard to their parents' boundaries. Here's where we see the importance of recognizing that adolescent assessment frequently needs to transition seamlessly into intervention. This includes helping parents 1. Understand the treatment recommendation, 2. Identify a plan and consequences if the client does not cooperate, and 3. Slam the back door shut as far as wiggle room. Up to this point, the client has probably maintained a great deal of power or control in the family system. Effective intervention works to remove that power from the client and give control back to the parents. That's the first step in helping the family restore healthy boundaries and dynamics, which most likely have been disrupted as a result of the impact a substance abuse problem has on the system. These are just some examples of how denial is managed in addressing a teen substance abuse problem. This is an ongoing process throughout treatment of a drug problem and will be examined more in Part 4.